Today we are going to discuss an important topic: what causes miscarriages. Now, experiencing a miscarriage is always emotionally disturbing more than anything else. And the only question which troubles you after this event is, why did it happen to me? The exact etiology is many times not very clear, but yes, many reasons have been shortlisted after years of medical research. Knowing the reason is important so that this event doesn't recur, and if the cause is correctable, we can rectify before getting pregnant again. Today, we'll be discussing these in details. So, hey there, I'm Dr. Deepti Asthana. I'm Senior Consultant Gynecologist and Obstetrician in Fortis Hospital, Gurugram, and I'm Director of Kalosa Clinics. Today, we'll be discussing the very important, sensitive, and emotionally attached topic of causes of miscarriages and abortions. You can visit my website at www.drdeeptiasthana.com and www.kalosaaesthetics.com to know anything related to gynae or cosmetic gynae. Please also subscribe to my channel Kalosa Gynae, where we'll talk about everything related to female reproductive health right through adolescence to menopause. Now let us see, what is a miscarriage exactly? Now, miscarriage is defined as loss of a pregnancy before 20th week calculated from last menstrual period. It is surprising that 10 to 15% of pregnancies do end up in miscarriages. Now, self-induced abortions are usually called MTPs. We'll cover this topic separately in some other video. Now further, there are many types of miscarriages, and let us know grossly what they are. Number one is the complete miscarriage. We say when all the pregnancy tissues have been expelled from our body. Incomplete miscarriage, when you pass some tissue or placental material but some still remains in your body, it is called incomplete miscarriage. Next is missed miscarriage. The embryo dies in utero with disappearance of heartbeat, but there is no immediate pain or bleeding in missed abortion. Now, what is threatened abortion? Bleeding and cramps point to a possible upcoming miscarriage. Coming to inevitable miscarriage, the presence of bleeding, cramping, and cervical dilation indicates that a miscarriage is inevitable. Septic miscarriage, this is abortion in which infection occurs within the uterus. Now, miscarriages that happen more than 3 times in a row are called recurrent pregnancy loss or RPL. Now, what are the signs and symptoms of miscarriages? What should be your alarming alert? Now, bleeding is the most common sign of miscarriage. Pain and bleeding, I always tell my patients, these are the 2 warning signs in pregnancy. You should always see your doctor immediately if you have following signs and symptoms of miscarriage, which includes any vaginal spotting or bleeding. This can be with pain or without pain. Any gush of fluid from your vagina, even if you do not have pain or bleeding. Any passage of tissue from the vagina. These all indicate that you need to see your doctor. Now, let us come to our main concern. What factors contribute to a miscarriage? Many times when patients experience painful miscarriage, they come back to me and they need an explanation. See, miscarriages have different reasons according to the trimester of pregnancy you are running. In first trimester, the causes of abortion are mainly chromosomal defects. Now, chromosomes are tiny structures inside the cells of our body that carry many genes. These are the basic units of hereditary. Now, there are 2 sets of chromosomes. One comes from maternal side and the other comes from paternal side. Chromosomal defect in the fetus will lead to abnormal development of the fetus. So, of course, this is beyond something under our control, and this is said to be nature's way of eliminating any defective babies. This can now be detected when the pregnancy tissue is sent for further genetic testing, which we also call as karyotyping. We can also undertake karyotyping for both the partners to see if there's a problem on one end or the other. Now, if this problem is occurring again and again, it is advisable to get the karyotyping done of both the parents. Now, there are other list of causative agents which includes any long-term medical issues such as uncontrolled diabetes, hypertension, kidney disease, hypo or hyperthyroidism can lead to increased risk of miscarriage. Now, being severely overweight also raises the chances of more abortions and miscarriages. Infections such as rubella, CMV, syphilis. Nowadays, COVID has also been implicated for spontaneous or missed abortion. Exposure to environmental and workplace hazards such as high levels of radiation or toxic agents, these all can cause abortions. Also, increasing maternal age nowadays is an important cause of miscarriage. The risk of miscarriage is 20% at age of 35. It increases to 40% at the age of 40, but further it raises to 60 to 70% at the age of 45. So we should avoid getting pregnant at later age. Now, there are some uterine abnormalities which can also lead to abortions, and presence of polyps and fibroids can also lead to early abortions. Also, we all know lifestyle factors such as excessive smoking, drinking alcohol, or using illegal drugs. These all can lead to abortions. Now, lastly, certain medicines such as the acne medicines which we use, isotretinoin, or the arthritis medicine which we use, methotrexate, these also can lead to abortions. Now, coming to second trimester abortions. Any abortion which is occurring in the second trimester or the late abortions of the first trimester, that is after 10 weeks, they also occur for a variety of reasons. These abortions are actually much more devastating, as by now you have already started forming bond with your fetus, and having abortion at this time is very sad. Now let us learn what are some of the causes. The most important cause is an autoimmune condition called antiphospholipid syndrome. Now, this is an important cause of abortion after 10 weeks of pregnancy. In this condition, maternal blood has a tendency to thicken because it has some antibodies. Now, this thick blood, this forms clots in the tiny blood vessels that feed blood to the developing fetus, and if these clots they reach the fetus, they block it, and so the fetus dies. Another important cause of second trimester abortion is cervical incompetence. In this condition, the ability of the cervix to hold the pregnancy tightly decreases. Cervix opens up without signs of pain or labor. Clinically, patient will not experience any pain, but cervix may reduce in length slowly. Remedy for this is need of suture at the mouth of the cervix if your doctor thinks so. Abnormal uterine shapes, having fibroids and polyps may also predispose you to abortions in second trimester also. Now, if we see, in general, many times the cause of miscarriages are known. In fact, many women experience recurring miscarriages for no apparent reason. About 1 in 100 women may experience recurrent miscarriages, but many of these will go to successful pregnancies also. So please be optimistic and keep trying. Now let us see what are some of the myths surrounding miscarriages. See, miscarriage usually is a random event, but many times females start blaming themselves or an event responsible for this. Working, exercising, stress, arguments, using birth control pills before getting pregnant, these all do not cause miscarriage. Also, some patients come to me saying morning sickness. This could have been the cause of my abortion. I always tell them no. Morning sickness, nausea and vomiting can never cause abortions. Some women who have had miscarriage believe that it could be result of a recent fall, blow or fight. Usually this is also not true. So concluding, if you recently have had miscarriage, stop blaming yourself for it. It is a sad event, but do see a qualified obstetrician to find out the exact cause, which could have been responsible for it, so that it doesn't recur again. Take a break before planning next pregnancy, give your body rest, and correct any preventable cause. Stay positive, and believe me, almost all of you would get pregnant again very soon. Do like and subscribe our channel Closer Gynae for more videos, and visit my websites deeptiasthana.com and closeraesthetic.com for any gynae or cosmetic gynae related issues. Stay hopeful, cheerful and careful. And thank you for watching this video.